And now it gives me great pleasure to introduce our first speaker for today. Please, Martin, will you put Vera on the screen beside me? So Dr. Vera Zimprich is a clinical and health psychologist. Good morning, Vera. It's very good to see you. Thank you so much for joining us and for speaking us today. It's lovely to see you.
Thank you very much.
And Vera has written very many publications and has a very, very great deal of experience in the whole field of working with children, understanding children, and child psychotherapy. And her talk to us today is the effect of war on the souls of children. Thank you, Vera.
Thank you very much. Sehr geehrte Vorsitzende, liebe Halyna Katolyk, sehr geehrte Damen und Herren, sehr geehrte Kolleginnen. In der Psychologie weiß man schon lange, dass bereits der Fötus in der Schwangerschaft von Anfang an die Mutter als Umwelt erlebt. Das Umfeld der Mutter, das sogenannte Mikrosystem, das aus Familie und privaten...
Psychologists have long known that the fetus experiences the mother as its environment from the very beginning of pregnancy. The mother's environment, the so-called microsystem consisting of family and private caregivers, can still be influenced by the mother, while the macrosystem, namely by the environment, culture, politics, and much more, has its own dynamics. For the fetus, on the other hand, the experience is a womb, and therefore the mother's mood is formative. There's a great connection between the sensory experience in the mother's womb and the later development of the relationship and bond with the mother. We can say that children are already strongly influenced by external influences during pregnancy. It is therefore clear that experiencing war in the womb is an incredibly profound negative experience for the fetus, which has a lasting effect on its soul and its development. To protect children during pregnancy, we must protect mothers, and the child's confidence or dependence on the mothers decreases with increasing age after birth. The children must be protected and strengthened all the more. War has a negative impact on the psychosocial development of all children. War basically robs children of the opportunity to live normal childhood. The daily struggle to survive and the effects of war on children mean that children have to take on responsibility at an early age in order to cope with life-threatening situations that often far exceed their age-appropriate abilities. This struggle for survival comes at the expense of their childhood, and this places a heavy burden on their souls. Even children who are not directly in crisis areas experience this loss of their childhood as a violation of their soul. Children in war zones are often witnesses or victims of violence and destruction. The direct confrontation with traumatic experiences and the constant threat, loss of family or friends, as well as the lack of security. This all leads to severe emotional stress, which can develop into serious psychological trauma and have long-term effects on psychological and mental health. War experiences have a terrible effect on all children. Children are torn from their homes, separated from their caregivers, shaken by bomb explosions, the wailing sirens of missile warning systems. Almost all children have to cope with the absence of their fathers, older male siblings or uncles, as almost all men between the ages of 18 and 60 are mobilized for war. In addition, many children are at risk of witnessing or experiencing physical and sexual violence. Experience shows that children who have been affected by armed conflict get back on their feet when they go back to school, stay in contact with their family and loved ones, and a bit of normality returns to their lives. As the soul is severely affected, the majority of children will need more intensive psychological support. Some of these children will show symptoms of post-traumatic stress disorder, usually from 2 to 4 months after this experience. This group requires intensive support from a special team of experts. However, it is not only the war experience itself, but also the changed behavior of the parents due to the threat and the war that makes them insufficiently or no longer emotionally available for their children. And this emotional unavailability due to the stress of war, triggered by emotional exhaustion, anxiety, and general overload, can lead to changes in parenting behavior. Parents can be overprotective, meaning too much protective, which inhibits children's development of autonomy. This overprotective behavior hurts the child's soul. On the other hand, parents may have less patience and empathy for their children due to their own psychological stress. Meaningly, they may react in a very emotionally neglectful way. The additional tendency towards emotional unavailability is compounded by the family's increasing isolation from community networks. This usually leads to a loss of social contact and support networks for the children. As we have already observed during the global lockdown, this has had a negative impact on children's social and emotional development. Children can become victims or witnesses of domestic violence, which has a dramatic impact on their emotional and mental health. We can also say that children's souls are so burdened that they can only express their suffering physically, meaning psychosomatically. Children do not yet have any life experience and cannot yet relate to dangers. And there is a question, what does that do to children when their fathers have to go to war? The smaller the kid is, the more likely it is to experience the father's being at war as a loss. It needs the child needs its father now and misses him painfully. The longer the father is away, and the more child loses hope and faith that he will come back. They also feel the uncertainty of their environment because it is possible that he will not come home again. The absence of fathers from the family due to the war and the physical stress leads in most cases to role shifts in the family, and older children may feel forced to take on additional responsibilities, while younger children often miss their father's influence, care, and protection. Fathers who were actively involved in the war are often confronted with traumatic experiences that affect their mental health. Due to the unspeakably severe traumatization that has burned deep into their souls, these men or fathers are unable to even begin to express what they have experienced. And these fathers have actually physically returned from war, have remained psychologically trapped in the war experience. As a rule, the children take on the emotions of their fathers in a nonverbal space and often express them nonverbally through their behavior. These open figures of the parents are now unconsciously internalized by the children and lead to family role shifts on a deeper level. In these ways, the child helps its parents to cope with the trauma without realizing it. The child has a deep emotional bond with the father. And the younger the child, the stronger this bond is. The child takes on and carries the unconsciously transferred burdens for the father, which he cannot express himself. The child then shows neurotic behavior or other behavioral disorders. In this way, the various psychological damages suffered by the parents during the war have a negative impact on the children. The parents secretly want children who will take their guilt or their own failures off their shoulders and carry their suffering for them. And this is a quote from Horst Eberhard Richard, Eltern, Kind und Neurose. It is therefore the task of child and adolescent psychotherapy to assign the open forms for the right people and to work with them. In this way, the open gestalts are processed and closed, meaning correctly assigned. And the children without secure attachments cannot develop as we know. When parents are rooted in themselves, they are emotionally unavailable for their children again. Children with developmental disorders have a lack of empathy. And knowing that their father is at war triggers deep fears in children about losing their father. It also causes an emotional insecurity that can become generalized. To be able to build relationship with other people in a fundamental way and to develop trust in relationships. And this fact can also traumatize children so that they would need professional support. And Gestalt therapists work with the children on their feelings and allow them basically to express their feelings first in the nonverbal space and then in the verbal space and develop their own coping mechanisms. In the event that traumatization has already taken place, trauma therapy will be necessary. And if the family dynamics have changed due to the absence of the father, work will be done on changing the roles in the family.
dass Kinder ihre Lebenserfahrungen verinnerlichen, bilden sie RICs. RICs, das heißt Representations of Interactions which were generalized. Diese bilden dann ihr ganz individuelles Selbst.
By internationalizing their life experiences, they form RICs, representations of interactions which were generalized. These then form their very individual self, which gives their soul a home. From a psychotherapeutical perspective, the mother-child relationship plays a crucial fundamental role in the emotional, physical, mental, and psychological development of the child. Early interactions between mother and child, even in the womb, shape the child's perception of itself and the world. Constructive state sharing promotes its development and basic trust. This is according to the great infant researcher Daniel Stern in his fundamental research on infants. In addition, John Bowlby emphasizes the importance of a secure emotional bond between mother and child as the foundation for healthy social and emotional development. In this context, Donald Winnicott describes the mother's sensitive adaptation to the ego needs of her infant. The so-called good enough mother thus makes the baby's maturation processes possible, whereby the reliability of care in infancy is the most important factor. In this way, children learn about their needs. But otherwise, if they're not this care, the existential fears can develop. So in this way, children learn about their needs. The feeling I had before I got the bottle was hunger. As soon as this feeling disappears, as soon as I got my milk, it vanishes. And we understand how such feelings by the kid can be characterized, his experience, according to different categories. And they can develop their independence and autonomy in this way. The central importance is the emotional availability of the mother, through which the child can develop emotional intelligence, identity, and the capability to deal with stress and difficult situations. We see that a mother must devote herself to the task of bringing her baby through in order to protect the continued existence of her kid. At this point, it must be said that younger children, in particular, are more vulnerable to war. War exposes children to an increased risk of all forms of violence and has extremely damaging long-term effects on their development. Prolonged periods of war cause severe anxiety, nightmares, aggression, separation from family members, and often forcing families to flee, etc., and thus impair the normal development of children. In times of war, psychotherapeutical therapies for children are particularly important. In a time of uncertainty, the reliability of psychotherapists is of utmost importance. In addition, it's important for the psychotherapist to be accessible to develop this reliable bond and care. In addition, empathy and maternal care are paramount. Children's therapists know that in such times of crisis, protection comes before therapy. The aim is to achieve a kind of ego strength and to support faith and trust in God. Good God who can protect, who will be there whenever needed. We, children therapists, have learned to invent and make up stories for the children that are good for them, that help them. These stories are told by grannies, by mommies. They come up with such stories that are particularly effective way of warning children of dangers and at the same time rooting them in themselves, in their autonomy, in their independence. It is important that the child's name or the names of acquaintances are never mentioned and that there is a complete change of location. Children cannot think of all of these things up till they are 12, for example. So we introduce them to the children. They have this function, a cognitive function, and they can think properly. But again, these functions are not developed this way, as we actually develop our functions of our brain throughout our life. So children are not mature enough, to grasp all these aspects by their thoughts. And such capabilities or the bounds, limits, of course, different researchers were working on these limits. And it is important for these stories, folk or authors, again, they have to be this way to protect kids from different threats. And as I have said, try not to use the name of the kid or their family members. The story has to be from far, far away land, or maybe in the animal world or in another part of the world. So the location should be remote and distant. So there should be this feeling of a kid to immerse into the fairy tale world. It's very much important. Never, never mention the name of the kid. Psychotherapeutical intervention can make a paramount input into the threatening situations to help them to deal with the traumatizing experience. Of course, war is pretty much stressful thing for both mothers and kids, as kids are amidst this fear and they are continuously trying to protect their child. The concern about the future and again the sense of loss also can lead to the psychological disorder and stress. Separation, war-related separation, losses or unstable living conditions can cause attachment disorders between mothers and their children. Difficulties in establishing or maintaining emotional connections can occur as well. Sometimes due to misunderstanding or some other reason. the mother's ability to care for the well-being of her children can be affected by the adverse conditions of war as well. This can lead to self-doubt or negative impact on self-esteem. But above all, it can also lead to deep pain and suffering. The soul wants to expand, take root, and find a home in the body. The great philosopher Martin Buber said, man becomes, ego becomes I through you. So the connections between the material and immaterial requires an encounter with the you. It is the relationship that is the basis of the relationship. And parents must be able to maintain their relationship. Whenever I have certain relationship with the child, I have to get tuned on that I have this and I have to maintain this relationship. So parents must be able to maintain their relationship with their child so that the child's self can grow and their soul can take root in it. If father is at war and mom is a refugee, right? So what we see is how difficult it is for the child to take root in it. The child doesn't know what is the foundation to stand on because family cannot provide them this foundation. So to summarize, we can say that the soul and the self of children are particularly endangered by wars. None other than Pablo Picasso portrayed this unforgettably, non-verbally in his famous painting Guernica in 1937. It shows the war, and the only figures are a mother with her dead child in her arms and her unbearable pain. I think we can share our screen with this picture, right? It's a world-known picture, Guernica. It was not by chance that he painted this masterpiece. Please have a look at the picture. Yes, you see this picture, this world masterpiece. It is a giant picture painted in 1937 before World War II started. And you see different algorithm figures, but there are two human figures. You see the mother with the child that I told about on the left. Have a look. We see her carrying her dead child. Just have a look at this part. Of course, this picture has been presented in the world exhibitions this year. And since then, this is one of the vivid examples of the expression of the endurable, unbearable pain provoked by the war in the world of art. That is unbearable pain and suffering. That image is the central of the maternal and children love. and again, of the cost, and again, of the love, how it has been developed, how it has been thriving, and then what is the loss? What does the loss bring? We have the beginning, or at the beginning, we can see what is destroyed by the war, because when our children die, that's the greatest grief. So, but also we can talk not about physical death, we can talk about psychological death, when the soul of a child can die due to the war, in terms of trauma provoked. I have seen this picture in Madrid. Ever since, I have this picture in my mind, because when I was invited to give the floor, I remember about this picture. Thank you very much for your attention. Take care.
Thank you so much, Vera, for your moving presentation to us. And I'm still caught by Guernica and by the image that you've placed before us of a child who was thriving, and then the death of the child brings unimaginable misery and tragedy. And this is what's...
Yes.
Okay, thank you.
Yeah, thank you very
One
much.
moment, please.
And thank you for all the images that you've given us in your talk. Thank you for all the theorists that you've introduced in your talk: Winnicott, Bowlby, Buber, so many important figures giving us insight into the relationship between the child and their family. And then you're talking about how that is changed and affected by war and by the absence of the father during war. It helps our understanding. And I love what you said about telling them stories, about animal stories and stories from nature. What are the things that we can do that can bring some healing? And this is so very important. Later on in the symposium today, we will talk about some of the games which children play, and play, and the creativity of play can be so healing. So thank you so very much.
I thank you. I thank you for having, for making this Congress, because I think it's very important to remember, or to speak about it, what the side of the children, because this is so in the non-verbal space. Yes, it's not so. What children suffer is they cannot tell us what is going on inside of them.
Yes,
and in their souls. So it's good that we can talk about it. We can talk about it, but it is very important that we can feel with the kids and can understand what's going on.
Yes.
In that. Thank you so much, very much.
Thank you so much. I just have one more comment to make, and also we just have a little bit of time, so if anyone has a question, please put it in the chat now, and perhaps Vera might have time. But also, I just wanted to make one comment. I mentioned the 90-year-old man who I talked to about his memories of the Second World War, and he said he was frightened all the time. And I was thinking about him while you were speaking. And there's no doubt that his soul was changed by his and formed by his experiences in the Second World War. But he's a very compassionate man, and he actually spent his whole adult career working with with children and with families who were in fearful and threatening situations. So somehow he had the internal capacity to transform his own early experience into something which meant that he could completely understand the experiences of people who were going through a time of terrible fear, and he could work with them with great effect and bring healing to them. So there's always sometimes that hopeful aspect. We can't know what the impact of war will be on children, but sometimes it actually brings resilience, depth, understanding, greater capacity for love.
And this is what we can do to help kids to come to resilience. Yes. Resilience.
Yeah. Okay. Vera, thank you so very much. No questions have emerged, so we'll move on to the next speaker, but we really thank you from our hearts for your presentation this morning.
I thank you. Thank you.
Okay, thank you.
Bye-bye. Bye-bye.